nursing here at the University of Plymouth, and hopefully later on I'll be joined with my colleague Professor Sarah Neal, who's also based at the University of Plymouth, and both of us together are leading on the Fit for Children and Young People's Project, or we call it the Fit4CYP for short. It has a flashy website, which I've put into one of the slides, which I hope will be sort of circulated at the end of the webinar, so those that are interested in understanding a bit more about the project can click on the link and can then have a look to sort of see how that project's been established and all of the sort of various sort of groups and programs and things that we have attached to it. So firstly, just thank you to Simon, Fiona and colleagues at the ABPN for the opportunity to come and talk about the project. I'm going to give a slight overview of the history of how the project came about. I will then go on to talk about some of the work packages or programs of work that we are conducting as part of this project as a whole. Some of them, well, some of the work packages have completed, and we have a number of packages that are currently in process and some future developments that we'll also talk about at the end. And if Sarah attends by then, I know she's going to talk about a little bit more about what's next. But essentially, the project's been established to look at the readiness for practice of our newly qualified children's nurses at the point of registration. And we've called it the Fit for Children and Young People Project. So a little bit of the history about the project, if I move on to slide 2, just so you can get an oversight here of the different packages that we'll be doing. But essentially the history of the project is back in 2018 when they released the NMC standards in 2018. There was a process through which all of the higher education institutes, or refer them as HEIs, went through to develop their new programs and their new curriculums. Within the University of Plymouth, we shifted from a model that was predominantly focused on delivering 3 years of a program to just our pre-registration children's nurses into a more shared curriculum. And one of the things that we found when we were developing our own program was the fear or the risk of some of that content specific to caring for CYP as being diluted. And looking at the development of the new standards, we were interested to find out how other HEIs had built upon those programs. So one of the things that we found when we were developing these programs was conversations with our colleagues. And one thing that we noticed that children's nursing, in terms of its academic numbers and its pre-registration numbers, were quite small. And we found that when we were trying to ensure that the content was sufficient and robust and set up in a way that enables our students to be adequately prepared for caring for children, young people and their families, that it was there was some challenges there, and largely for us at the University of Plymouth was due to our cohort numbers being smaller and also our academic teams being smaller in comparison to some of those other fields of nursing like adult nursing. We don't actually run a learning disability program here at the University of Plymouth, but we have a sizable mental health program as well. So what we found through discussions with academic colleagues and in part through the CYP NA UK network is this sort of shared feeling that programs were changing, that they were shifting, and there was 2 sort of themes or common points that were coming forward as part of these discussions. One was the perception or the worry that the standards were particularly generic in their focus, and the other one was then the impact that will have on education programs and the fear that these new education programs within HEIs may be potentially diluted in terms of that content for its children's nurses. So one of the things that we found was a big challenge for us in terms of developing our own curriculum was looking at the evidence base and thinking, well, what do we have out there which clearly establishes children's nursing as a field of practice, but also importantly, what the evidence suggests about getting the balance right in terms of those pre-registration programs. And interestingly, as we started to look at the evidence base, we found that there was quite a paucity that was there. There's bits and pieces, but there isn't a lot. There's some work which had been undertaken by Alan Glasper in terms of consolidating the sort of history of children's nursing, but not much in terms of that empirical work. So a small group of academics got together. I think it was back in 2020. That was from colleagues from Buckinghamshire University, Christchurch, Canterbury, and University of Plymouth that were leading on it. And the whole philosophy behind this small group was to look at a bit more detail in terms of what those program structures look like. That quickly gained traction, and I stepped in to take over from one of my colleagues, and Sarah Neal also joined us, and we found that we were able to start to build a bit more of a stakeholder group nationally within the UK, and opening that up to academics across the UK, practice representatives, and as you'll see on the previous slide, we also reached out to the ABPN, Nathan Askew within the ACCN, colleagues within NHS England, the NMC, and also the CYP NA Academics Network. We've also reached out to a number of other sort of organisations which have also been involved in terms of having discussions around the project. So what have we done as a result of that project? Well, we set out a stall in terms of some packages that we wanted to put together to help to build that evidence base. And that was one of the primary goals, is how do we start to build that empirical research that demonstrates the importance of having children's nurses which are adequately prepared to care for children and people and their families. And so because there was a paucity in the evidence base, we came up with a number of packages that we felt needed to be built into the Fit4CYP project. So the first one was to create a cross-sectional survey and to use that to currently look at what HEIs across the UK have essentially rolled out as part of their pre-registration programs for children's nursing, because that's one thing that we didn't clearly have is a picture into what that looked like for other sort of other HEIs that are delivering those programs. And the purpose behind the survey, which has now been completed and published in Nurse Education Today, was to establish the impact of those standards on the structure and content of pre-registration programs. Okay, so that was one of the first packages that we put together. The other thing that we wanted to establish is a systematic review that looks at not just the national, because we're aware that the UK is unique, like Italy, in that it still offers programs in relation to the 4 fields of nursing, where internationally there are essentially more generic focused programs. So one of the things we wanted to do is to gather some evidence around what does that national, international literature look like in terms of those factors that influence pre-registration nurse education. And that's more around the preparation for children's nursing students to be qualified children's nurses that are caring for CYP and their families. We wanted to build upon the historical work that has already been put together through Alan Glasper, which was back in 2002. And I know that Sonia Clark has also done an update in 2017. So I know Fiona's involved with this, and we're working on putting together a sort of a visual timeline that presents the sort of updated historical perspective of children's nursing. One of the things that we also wanted to achieve is establish what that international picture looks like. Sarah and I are part of the International Network for Child and Family Centred Care, or INCFCC for short, and we're also part of the International Nursing Family Association, or IFNA. And it's interesting when you have those sort of anecdotal conversations with professors, academic doctors, those representing children's nursing across various countries, is to understand a bit more what it's like for them in their countries with regards to preparing and training nurses to care for CYP and their families. And the picture's quite interesting. So again, one of the work packages that we've done as a result of that, and I come on to talk about that in a bit more, is to develop a cross-sectional survey which captures the international picture of how children's nurses are educated and prepared. Okay, we've called that the Astound study, and that is currently in data collection. We're looking to close the survey at the end of next week, and we've got some really good response rates to that as well. So I'll talk a bit about each package as we sort of go through the webinar. The final two packages is looking through the lens of, okay, what do we need to do in terms of that empirical evidence? And how do we ensure that we capture some of the qualitative and the quantitative components around preparing pre-registration children's nurses? One of those is a project that we've established here at the University of Plymouth, which is exploring field-focused education and the risk of attrition among student nurses from the field of children's nursing, because I'm sure as many of you are aware, whether you're representing HEIs or practice, there is a big challenge at the moment nationally around recruitment, retention and attrition. We've been working quite closely here at the University of Plymouth with NHS England to explore that in more detail. And I've been involved in a research workforce group that's leading on some of those research projects. But one of the ones that I'll come on to talk about in a bit more is some interesting data that we captured around students perceived of leaving their programs due to a lack of field-focused education. And so we've established a qualitative research project to capture that in more detail. The key thing, and this is where hopefully Sarah will come in to talk more about future steps, is looking at what other research needs to take place. And we have a few proposals that we will come on to explore at the end, but one of those is looking at a piece of research, a piece of funded research that explores what factors promote patient safety for children, young people and their families that are cared for in children's wards. So that's just a starting point. But again, with the national picture, it's important to actually potentially look beyond education and think about, well, what is the perceived impact on sort of patient safety in clinical practice? So that's it in a nutshell in terms of the project, in terms of the current packages that's going on. So we've been working on these packages and delivering these packages now for the last sort of 2.5 years. And as I said, some are complete and some are in the process of being established more robustly. So what I'm going to do now is I'm going to go on to talk about each of these in a little bit more detail. And Simon, just do let me know if there's any questions that crop up or anything in the chat. Okay. So the first package, I mentioned a little bit about that when we were starting out, we were aware that there was a number of HEIs that were registered as delivering pre-registration children's nursing programs. But what we didn't have a clear picture of is what the structure and the content of those programs look like. We're aware that they have all gone through NMC approval. But through those anecdotal conversations with colleagues, academics, through those networks that I mentioned previously, there was a perception that there were different models depending upon the sort of location and the structure of the HEI, depending on where it is within the UK. So the first step we felt that was important to establish was to determine more clearly what has the impact of the new future nurse standards been on shaping those pre-registration programs. So this was a piece of research that we led through the University of Plymouth and in partnership with our colleagues from Buckinghamshire New University, and we're grateful to Mel for being part of that team, and also Marianthe, who Mel was able to establish some funding to enable Marianthe to come on board to essentially pay for the data analysis on this project. So we're very fortunate through that. So this project, which was led as part of a team, but the paper sort of written up through one of our colleagues at University of Plymouth, which is Bex Reynolds, and Bex also went on to present the data that was collected through this survey at the RCN Educational Forum, which was the national conference back in 2024. So, as I said, the paper itself we did write up and we submitted that to Nurse Education Today, which is quite a well-established and high impact factor journal. And we were all surprised to find that the paper come back with very minor amendments, which Bex was able to turn around fairly quickly and have the paper published back in 2004. So again, this is a cross-sectional survey, so this was very much a picture of what those programs look back when we took the survey, which was in early 2024, coming into spring. So again, because the paper is published, I'm only going to highlight some of the key findings. I'm not going to go into too much of sort of nuances of every bit of data that we collected, but just to highlight some of the sort of core findings that we found. The first thing to present is, well, what were the sort of clear aims and objectives of that? What was the research question that we set out as part of the project? The aim of a cross-sectional survey, as I said, was to investigate the impact of the standards and to capture the degree to which generic education content is being provided within those children's nursing pre-registration programs. We sent this survey out to those that were involved in establishing those programs, or involved in delivering, or as those sort of field leads within those pre-registration programs across those different HEIs. And the key research question was, how have the pre-registration curricula changed following the introduction of the NMC standards across HEIs in the UK? What we wanted to achieve, ideally, as within our survey, was to capture a response from every part of the UK that's represented, and we were able to achieve that through our geographical locations. So we managed to get responses from Wales, from England, from Scotland, and Northern Ireland. And when we looked at England as a whole, we subdivided that into the regions that are sort of identified and presented by NHS England. And again, we were able to capture responses from every single of those sort of 7 regions. We went to the NMC database, where there is evidence of those approved nursing programs, and that was a big piece of work which we did in the beginning, which Mel was instrumental in pulling that data together to establish, how many programs are being provided. What we noted is that there was a number of children's nursing programs or pre-registration programs that were being delivered across 67 approved education institutes, or HEIs. From the responses that we collected, we had 76 responses for programs that was represented across 54 HEIs. So in total, this worked out to be about 80% of the potential 67 HEIs. So we saw that as a win in terms of capturing some good scope of what the survey was able to identify. The project was a labour of love for most of the research team, as in we used our own scholarly time with which to conduct the research, but we were fortunate in that Mel was able to put in for some money to bring Marianthe on board to conduct the some part of the analysis for the survey. So we were grateful to Mel and Marianthe for that as well. Other than that, the rest of the project was unfunded. It took us around 12 months to establish the project and to put it out for data collection, and then about another 6 months to analyze all the data and to write it up as a paper. So again, these are only snippets of some of the data that we captured. There is a variety of different sort of questions that we asked, and as I said, that paper is published for those that are interested in reading a bit more. But one of the slides I've put up here is looking at the type and location of pre-registration programs. So this is in terms of the award that's provided. So unsurprising to many of those that are here today representing HEIs, the bachelor's degree was the highest program type, and we found the frequency of that was 50 programs. And that was offered around 65.8% of those programs that are offered. And you can see from the sort of bar graph here, each of those sort of areas of the 7 parts of England and also other parts of the UK as sort of represented according to those areas. Master's degrees come next. There was 18 of those in terms of the frequency. There is still examples of postgraduate diplomas available, evidence of apprenticeship routes emerging in pre-registration children's nursing education, and one other. So this was again a total of sort of 76 from those program structures. One of the pieces of data that we wanted to collect was to better understand what had changed from programs that were being delivered prior to the introduction of the 2018 standards and the development of these new programs, because as I mentioned, these were some of the I suppose anecdotal themes or concerns that were raised by academics that we had those sort of conversations with through those networks. And so one of the questions that we wanted to ask, and some of the data that we wanted to capture, what has changed in terms of the theoretical content and also placements, because we know within these programs 50% is based in theory and the other 50% is based in clinical practice, a total of 2,300 hours for each. So since the introduction of these standards and development of these programs, this is what we know about child specific theoretical content, or what we called sort of field focused content in other papers that we've published. So from all of the respondents, half, so 50% of respondents, reported that theoretical content had changed for the most part. What was interesting is that 35.5% of respondents reported that children's nursing content or child-specific theoretical content had decreased in their programs. So there was a decline in children's nursing content. But interestingly, there was some HEIs, 14.5%, that did see an increase in content. So there was a slight shift in some of the programs that were able to provide more, but there was quite a high percentage of those who actually saw a decrease in the content that they were previously providing. One thing that was positive to see through the survey when we look at placements is that the majority of placements, over 82%, saw no change, and only a small percentage of those that saw a decrease in the child-specific placements. Now, this is quite unique. I know at the University of Plymouth, we also provide a dual registration program, which is something which is available in some of the HEIs. And we know of those programs, there is often a split between the sort of placements that's provided across those fields within the 4 years, at least for the University of Plymouth. So there's a variety of other data that we did collect. So it was a cross-sectional survey that not just collected descriptive data, but also had two open text box questions to enable us to capture any additional comments and some further feedback from those that completed the survey. I think we have to be upfront honest in terms of a limitation or a recognition of potential bias, is that those that completed the survey were those from children's nursing pre-registration programs. Okay, so this was the feedback that was provided just by those academics. But when we took the qualitative data, we did some analysis and came up with 3 themes, and the themes of those was feedback from program providers that the focus of new HEI programs have become very generic. One of the things that was reported in the findings was also the challenges that a lot of these HEIs are facing in trying to achieve the standards of proficiencies, given the number of them. And also one of the other themes that we established was that there was a perceived dilution of child-specific content. So as I mentioned back at sort of the initial introduction to that slide, our colleague Bex Reynolds, who actually took the lead on writing up the paper, also had the opportunity to present that at the RCN Educational Forum back in 2024. So again, an opportunity to present some of the data of that survey. So that was one of the packages that we were working on. And now that we had established that, one of the things that we also needed to find out is what exists in terms of the literature around not just the structure of those pre-registration programs, but the proportion of content. How does that impact upon newly qualified registered nurses' perceptions of being prepared to care for children, young people and their families, because we saw that through the survey there was shifts and changes in terms of the content that's being provided. But one thing that we also wanted to establish is there any empirical evidence or publications out there which call into question or discussion or explore this whole concept of proportion of content in more detail. So that's essentially what I look to establish as sort of work package 2. So we came up with the concept of putting together a systematic narrative review, and the protocol for that was published in Comprehensive Child and Adolescent Nursing. And the key focus of the review is how does the proportion of, we called it child-specific content, but we also refer to it as field-specific content or child-focused content within these pre-registration programs. How does that impact upon newly qualified registered nurses' perceptions of preparedness to care for children, young people and their families? And we put it under the banner of registered nurses because, as I said back along, it's only the UK and Italy, to our knowledge, that currently only offer registrations in those fields of nursing. Otherwise, you are a registered nurse. So this is a review that I'm leading on, and I'm also working in partnership with two colleagues from the University of Plymouth, Danielle Edge and Sarah Neal, and two academics from Auckland University Technology. So that's Dr. Julie Blamirez and Mandy Foster. And both Mandy and Julie have identified sort of a similar program of work that they want to do within their own institute, and have similar kind of concerns to us here in the UK and challenges like us in the UK with regards to their pre-registration education. And so they were very keen to also help us build this narrative review. So the full review actually is being written up now. One thing that was really interesting that we found is that those that are familiar with systematic reviews will know that what we try to do is we use very structured and comprehensive methods to try and establish all available evidence on a particular research question or research focus. So with the question that you can see there around the proportion of content, we wanted to go as wide as we could, not just nationally, but internationally, to see, is there any evidence? Is there any empirical research that talks about this proportion of content? Interestingly, through the searches that the research team did, we established that there is no evidence out there, not a paper at all. So that in itself is quite a bold statement and quite concerning, that when we think about the need to explore not just the structure of these programs, but the proportion of content that's needed or required in order to adequately prepare these nurses, what does that look like? Well, the truth is there is no evidence out there. So I've not come across this before. One of my expertise is in conducting systematic reviews, and so with the search providing very limited evidence out there, one of the things that we are doing now is essentially writing this up for publication as a review of no evidence, because even though we weren't able to retrieve any studies, that in itself is quite a bold statement and something that needs to go forward for publication as part of this review. So we will go ahead and we'll publish the narrative review, but it would be a review of no evidence. So a lot of the discussion will be around looking at potentially why those gaps are there, and what we need to be doing in order to ensure that those gaps are fulfilled. Just looking at my watch for time. So we've done some survey work. We've got a UK picture, and from what I've presented, this is what we know about those changes. What we also know is that there is no current evidence out there which establishes the importance or what the structure of those programs look like in terms of its content. So as I said earlier, we're dealing with a very small paucity of evidence, but one of the things that I presented to Sarah and the research team is that we have to be mindful not to only allow our lens to focus upon the UK only as the marker for what these programs should look like. And bearing in mind that, as I said, we are unique as a country in terms of providing or still delivering registrations within those 4 fields. But we know internationally that it's very different. Now, through the INCFCC, I was in conversation with colleagues there, and what was interesting to talk to colleagues, and again, these are professors, associate professors, doctors, leaders of sort of children's nursing, CYP education, and for their families across various countries in the globe. And there's a similar kind of concerns that are coming forward, that we don't know exactly what that picture looks like, but what is perceived is that there is potential lack of preparation. But again, this is very anecdotal. So one of the things I presented to Sarah and the team is that we need to go a bit beyond the UK, and we also need to have a look to see what is happening in terms of that global picture. So I established a second research project, again, which is another cross-sectional survey, and this is called the ASTOUND study, or essentially an acronym drawing down letters from the key focus, which is exploring the global provision of pre-registration nursing education. And again, same focus, looking at the preparation of student nurses to care for neonates, infants, children, young people and their families. And I've entitled this the ASTOUND study. So this is what we wanted to do, or what we are doing as part of this cross-sectional survey, is to explore what does that global picture look like around provision? What do we know? The evidence is very limited, so again, we need to explore that in a bit more detail. And we set a couple of objectives. So first, we want to look at it from the perspective of theoretical content. What's the current provision being offered around that to these pre-registration programs? To establish what practice learning looks like with children, young people and their families within different countries. So it's a theoretical component, it's that practice component, and also to identify what postgraduate or post-registration education looks like. Because as I mentioned, a lot of these programs you are undertaking as essentially a generic program to become a registered nurse. But we know that some countries do offer post-registration in what some call specialist fields, but more importantly, within the area of neonate CYP. So again, through the survey, we also want to identify within each country, if there isn't so much in terms of a pre-registration program, and if we are looking at it from the perspective of theoretical content and practice content, what was also available in terms of that post-registration training. The survey, we established an expert panel from colleagues that were made up of the network, the INCFCC, those are also represented as part of IFNA, and also through international contacts that I was put in touch with through the expert group. And the whole point of the expert group was to essentially inform how we develop a survey, because this is the first of its kind. But as you have to imagine, there's a variety of complexities in how do we make this accessible, and how do we use the appropriate language across 100 of nearly 200 countries, if we were to get a response from each and every one of those. How do we make that accessible? So that's where the expert group came in, and we did a little bit of work around trying to determine terminology, because the term children's nurse, or children young people's nurse, or pediatric nurse, some of these may mean very different things in different countries. So when we're thinking about the language that we wanted to build into the survey, how do we determine what is the most common terminology? So I did, again, another sort of small survey. This wasn't as research, but as a scoping exercise. And we established through that, I think we had 76 countries represented. And from those responses, we determined that paediatric nurse and children's nurse are the most common. I've written that up as an expert opinion paper, which has been accepted to be presented at the IFNA conference in Perth, which is coming up in June. So that'll be a good thing to present there. But once we were able to establish the language, we developed this cross-sectional survey, and we distributed it to the members of the INCFCC, and also those as part of IFNA. And we also drew from the expertise and the involvement of Catherine de Winter, who had done some scoping work around Europe around paediatric nursing, and that was as part of the Paediatric Nursing Association of Europe. Professor Jane Code is also involved in this project, as well as the sort of chair of PNAE. So again, we've got those important contacts to help move this research forward. And one thing I was surprised at, or shouldn't be surprised at, but was great to see, is just how well received this project was with those international stakeholder groups. So if I show you this next screen here, this is just a list of the group that we have established. So looking at the individual, what institute they represent, and the country. So we've got the UK, Norway, Belgium, all the way through to USA, Canada, South Africa, United Arab Emirates, Indonesia. So we have generally most continents covered. And with the survey, what we would like to achieve is to have representation from at least countries from each of those sort of 7 continents, but we're not including Antarctica, because unfortunately, unless we're starting to run pre-registration programs for penguins, that there are no nursing programs that currently runs in Antarctica. And as I said, the survey's been out for the last 3 months. That's the sort of unique poster that we sent out with a link to the survey. And so far, as I checked it this morning to kind of see where we're at, we have 131 responses so far. So we're looking to close that next week. There's a couple of countries that we're still trying to target, and snowballing by getting colleagues to pass this on to their connections they have across other HEIs. But this is established research. We're at the point of hopefully closing data collection soon, and then we can start to analyze and see what that looks like. There we are. So as I said, we've done a expert opinion paper. We're in the process of conducting a more wider international survey. We've done a UK survey, we're doing an international survey, and that is starting to bring out some really interesting data just through sort of preliminary looking at those responses as they come in. And that's going to hopefully give us a bit more of the sort of global picture of what those programs look like, both pre-reg and hopefully post-reg as well. But when we bring it back to the UK, and when we think about what is some of the work that we want to do, there's a variety of programs that we will be undertaking, but one unique and smaller program that we're doing here at the University of Plymouth, which is attached to the Fit4CYP project, is this project which is exploring field-focused education. So we mentioned child-focused education, we call it field-focused education as part of this project, and the risk of attrition among students from the field of children's nursing. So one thing that we did here in the Southwest that was led by the University of Plymouth was some funded research through NHS England that looks at attrition. Why is it that student nurses are potentially at risk of leaving their programme? And as you can imagine, there is some clearer findings through that survey that look at sort of financial complications and challenges and aspects like that. But when they captured data on the field of children's nursing and mental health nursing, what they noticed is that the top reason for those fields being at risk of leaving their programme was what they referred to as a lack of focus on field-specific training. So for child health, that was 78% of those responses, and 71% in mental health nursing. These were students who were at risk of leaving their programme because they felt that there just wasn't enough focus on the field-specific training. Now, I asked permission through a head of school to potentially do some secondary data analysis, but there just wasn't enough in there. This was a mixed methods project. It was a survey. It was also focus groups. The focus groups weren't clearly represented by child health and in particular mental health as well. So we requested to essentially do some further qualitative research to explore that in a bit more detail. What is it that students mean by field-focused education? So this was approved, and again we have this sort of approved for the head of school through ethics. We did initially have some money through NHS England with which to run this, but with the change of government and changes within NHS England, that money's on hold at the moment. So again, this is an unfunded project that's being delivered by the research team, and that you can see there, which is myself, Danielle and Bex for children's nursing. I'm also leading on this from the perspective of mental health nursing as well, through some of my academic colleagues in the field of mental health nursing. But the objectives specific to children's nursing is first to identify, what is those perceptions on the amount of field specific education in their current programme. We want to understand what they mean by that reported lack of field specific education. How does that specifically impact upon their risk of leaving the programme? And then the final point is to look at for me, one of the most interesting and most poignant parts is to explore the perception of these students in terms of preparation. How prepared do they feel to care for patients in their field of practice? So this is going to be through focus group interviews with nursing students. We've done some online focus groups already, and we're doing some face-to-face focus groups in early March. So again, we hope to have some data from that, and with a plan to publish it as well. So that's very small in terms of a local project. Now, I'm going to gaps in the evidence. I don't know, Sarah, are you there, Sarah? Stop share a moment.
I don't think she's joined.
Matt, no.
She's not joined, has she?
No, I don't think she's joined.
Oh, okay. I'll have words with her later on. That's fine. I'll carry on with Sarah's bits then mindful of the time that we can then have a bit of an opportunity for some questions at the end. So, as you've heard from me waffling on, there's lots of parts to the Fit4CYP project, and some of them are smaller projects, some of them are larger in terms of hitting that global perspective, and a lot of the work that we're doing is still very much embedded within the UK and that UK focus. So one of the things that we now know is, where are the gaps in that evidence? Well, one thing we don't know about is the pre-registration programme impact upon preparedness for practice. We're doing some of the local work around that. We know that there is concern around the reduction of child-specific content, and so we have a little idea that there's some gap there in terms of the evidence. We're also looking at it from the perspective of those educational influences. What does that look like in terms of children's nursing ability to provide safe care? Okay, so this is kind of thinking about the educational impact, and how that may have potential impact upon not just preparedness for practice, but those newly qualified registered children's nurses' ability to provide safe care to CYP and their families. And that could be impacted by a number of different factors. That could be human factors within the practice environment. It could be a number of environmental influences in that as well. I think one of the things that we have noted, and this is through the last 3 years of trying to establish a larger scale funding, to run a project of this size, is that there isn't an abundance of money available for educational research. And we found that, as I said, a lot of the work that we're doing at the moment, most of it has only been funded through scholarly time and small pots of money to various smaller aspects of the project, and largely through myself leading on the project with Sarah. But one thing we're starting to think about now, if we look at it through the lens of impact upon patient care, is there an idea to explore factors in a bit more detail? And if we think about that, then we move beyond education, and then we start to consider impact in patient care as being now within the sort of clinical, within the healthcare realm. And so that gives us the ability not to necessarily apply for educational funding, but maybe to start to look for funding that's available through some of the larger healthcare funders, such as the NIHR. So we are in the process of developing some applications, some projects that will be targeted more towards things like research for patient benefit, in the hope that we can start to fulfill some of these gaps and build a bit more evidence around that. I think this is kind of where I would talk about more the challenges, and I've mentioned that there is that lack of funding, and that's one thing that we have come up against in terms of a barrier. There just isn't money out there for educational research. And specifically when we think about if we're trying to build something that's suitable for the NIHR, well, actually they're not necessarily interested in funding educational focused research. So again, there's that motion that we need to move beyond that to think about how we shape this in terms of it being more of a sort of a patient forward process or project that's looking more specifically at trajectory towards patient benefit. One of the things that we might find when we start to look at some of these factors is accessing, even anonymizing trust level data on critical incidents around research. Now, that in itself is a sensitive point. And so one of the things we're starting to think about more now is being more pragmatic around what would a research project look like that was instead looking at where the strengths of practice is currently, or what I should say, where practice is providing markers of strengths around promoting patient safety, almost as sort of an appreciative inquiry approach, whereby rather than just focusing upon the negatives, you start to think about, well, what's working well? Why is that working well? If we delve a bit more deeper, is there anything that we can develop in terms of a set of outcomes or recommendations to build upon that? So again, these are just some of the conversations that we're having at the moment, but we have to be mindful how we craft that, because if we're looking at impact upon patient safety, we have to be very sensitive and mindful about how we start to think about accessing trust data. The other thing is again thinking about that there's such variability in the pre-registration programs in its structure and delivery that we couldn't just do this in one potential site. We have to think about, well, what's being provided in terms of different institutes representing different parts of the UK, because we know, talking to my colleague Robin Hyde, that they provide a very different type of program in Northumbria to what we do here at the University of Plymouth. But what the University of Plymouth doesn't have is a paediatric specific hospital within the sort of southwest region. The nearest one to us is Bristol, where in Northumbria and other parts of the country, we know that they also have not just DGIs, but also those paediatric specific hospitals. So these again are just some of the conversations that we need to think about. When we look at solutions, one thing that we will continue to do is to build upon and execute these small scale studies, because it all helps. And without any access to a large pool of funding, this is how we're currently approaching it. We can't develop something, we're developing, a project that's going to be bigger, but more importantly, at the moment, without that money in place, it's how do we incrementally build that evidence base? And you can see examples of that through the packages that I've already presented. There may be an idea to think about how we might build this in terms of PhD projects. We know there's a variety of scholarships that are out there, and there may be academics who have PhD students who are looking for areas more specifically within children's nursing to explore. So again, it may be that this is something that could be undertaken as part of a PhD. But for us, and where we're moving forward now, is to think about those projects and shaping projects that are looking more practice focused to concerns such as patient safety. What is the perceived impact based upon some of the areas that we've already been able to establish through the research? And again, very much open to other ideas as well. So I'm mindful of the time. I've waffled on for nearly 50 minutes. So what I'm going to do is, now that's the end of the slides, I'm going to stop share now, and just to see, is there any questions or anything that anybody wanted to ask at this point in time? Hopefully that was clear and useful, just to kind of give you an oversight, or an insight rather, into the Fit4CYP project. So thank you for listening.
Thank you, Matt, for that. Really interesting overview of the project so far and what you've achieved. It sounds like a real dedication and commitment from everyone for pulling it all together, and I guess the continued engagement is really positive as well. So there was a question in the chat, I think it was from Fiona. It was relating back to the responses that you were collecting, and which countries were you still waiting for a response from?
Yeah, so there are a number, Fiona. I don't know them off the top of my head, but I know. Go on, carry on.
I was just going to say, if you drop me an email, I'll see if there's anybody that I've got contacts for.
That'd be great. Yeah, and likewise anyone else in the webinar who has international contacts that would be keen to pass along the flyer for the study. That would be great. And again, we're not just, what we're trying to do as well is not just capture responses from continents, but we've also got a number of responses within countries, because again, if it's anything like the UK, we know that different HCIs will provide different things. So that is going to be a challenge and a limitation of the survey. But I think we've got over 25 responses from Italy. We've got about 20 from India. So again, it's not just looking at one response, but if can we do that one step further and try to identify different HCIs within each country. That's a starting point.
That's important across Europe as well, because, for example, Germany, they've got different provision in different places. So yeah, absolutely.
Yeah.
Great, thank you. Is any questions? Jean? And
thank you for that, Matt. Really interesting. Jean Davis, I'm from Bangor University, but also with ABPN. The one thing I have been struggling with, and is getting across to undergraduate children's nurses, is exactly what you said about less of a field-specific focus. And there is an all fields workbook within the NMC standards and their practice assessment document. And also there is quite a lot of interprofessional education within the first 15 months. And that, you know, whilst we want to just be delivering children and young people's education, there is an actual benefit to the interprofessional education and the knowledge that, you know, the students are going to be working with these big teams and the referrals on to multi-professional teams. So I just wondered if anything is figuring in your, you know, work in relation to that. Thank you.
Yeah, that's a really good question, Jean. And one thing I forgot to mention earlier as well is that as part of the UK survey that we did, it's again about establishing the picture, because we also recognise that there is benefit for training students across the lifespan, you know, to have that exposure as well. But in terms of IPL, we didn't capture that within the UK survey, but that is a question that we have built into the international survey, so the Astound study, because again, through the conversations that we had with colleagues representing their own countries, it was same as what you're sort of saying there, Jean, that there is an important benefit of thinking about how, you know, we learn and involve and embed the learning that comes from other healthcare professions. So that is one of the questions, and it'd be interesting to see what comes out from that as part of the international survey. Although we appreciate that one thing we won't have is probably the same sort of picture that we have across the UK. We have a number of UK responses, but not as many as we achieved through the original survey. Does that answer your question?
Sorry, yes, thank you. But another aspect of this is it might dilute some of their disappointment at it not all being their field from the very beginning. And it's not just child field who feel like this. Learning disability nursing also feel very, very similar, don't they? Thank you.
They do, yeah. Thanks, Jean.
Thank you. And yeah, Fiona's just popped in the chat as well, Matt. If good point, Jean. Some universities provided children's nursing and social work programs together, and I know that obviously there's a growing number now providing children's nursing and mental health dual qualifications as well. So it's, I think, slowly getting there. And that was going to be kind of my question about, obviously, from a learning disability nursing perspective, obviously who are an all-age training package. How does that then link in from the children, young people's perspective? And obviously the move now towards having kind of multi-professional teams across other sectors like children mental health, for example, and so that actually it is addressing the whole lifespan, but you've got the specific qualifications for those particular cohorts, whether that's physical health or mental health. And when we brought international nurses over as well, when we've had international recruitment campaigns, and you've got specialists who work within paediatrics in their own originating country, but then obviously don't have a children's nurse qualification as we would have in the UK, the support and factoring kind of that support and what level of support those internationally recruited nurses may need, and often feel that they're not either even employed as nurses, but employed as healthcare assistants because they don't meet the requirements for registration, for example. So it is something which is cropping up more and more often now.
Yeah, that's a really good point, Simon. And I think, yeah, there's so many different directions and things that we could build on as a result of the project. As we're finding, is that it's not just the paucity of evidence. It's the challenges around how do you fund this sort of work. I know Sarah and I have also been working with the Health Safety Investigation Bureau, because there's been a number of reports that's come out from that organisation with regards to the challenges faced by CYP and their mental health, isn't it, within acute settings. So there's a number of different directions that we could take this, but it'd be interesting just to see what we establish in terms of the picture. There's Bernie. Hi, Bernie.
Hi. Leonie's actually got a really good point there. I can hang on, Matt. I can contact you some other time.
So I missed it.
Leonie in the
chat. Yeah.
Should the NMC just consider 2 fields of practice, adult and CYP with mental health and learning disability incorporated into both, as mental health and learning disability can occur across the lifespan? Brave words, Leonie. Just imagine mental health and learning disability probably rioting, but go for it. I think we need brave ways of thinking about things. Yeah, I think my sense is that it's really disappointing that it's 2024 and we still haven't got evidence.
25.
And yet we've been 25. Oh God, 25. Yeah, it's 25. It's 2025. Yeah. It's even more disappointing seeing as it's 2025 that we still haven't got the evidence, and yet we've been through this cycle of trying to defend our position as important and necessary. And I think it's the same. We've always come up with against those same challenges, like no funding, really hard to get traction, to get the sort of evidence. So yeah, I think you're doing a brilliant job.
Thanks, Bernie. And I think I probably haven't credited enough that the academics that we've been working with as part of the Fit4CYP will have a stakeholder group, and we have representation from the NMC, from the ABPN, from the ACCN, all these other organisations, and wherever we've had these conversations, with the RCN, there is a lot of positive support with regards to the project, and I suppose kind of rallying behind us to keep the work moving forward, which is great to see, because at least it kind of reminds us that we're trying to fill a very sort of limited evidence base that's there at the moment, and it does take an extreme amount of work, but as I said, without money you can only do so much.
Ollie, get out my bag, stupid animal.
Jenny's got her hand up.
Yeah, one last
Something like
question. I'm just mindful of the time. It's now
Yeah,
past,
That's
so,
the angry. He's going down my bags.
Okay, Jenny.
Oh, I was just going to add that I like Leonie's idea of like incorporating it as either adult or CYP, but I suppose if you went into those fields like LD or mental health, you really constrict your career opportunities, don't you, if you're just focusing on that sort of element. So I just wondered, because there's some nurses out there who maybe like to do LD, but they cross across both year groups, don't they, across their careers, and that might constrict them if they've got a big interest in it. But interestingly enough, the children's conditions that we're looking after now, compared to like maybe 30 years when I qualified, have got more, they're more complex and do need more mental health and LD support sitting in them. So, there's arguments for both cases in terms of that, isn't there?
And then there are some universities that are starting, I think I mentioned it, starting to offer more of these sort of dual registration programs. It's not a solution because actually it means that there's normally an additional year of study within sort of master's level, but they get the sort of 2 qualifications at the end of it. And I don't think that's a model for success, but it has been beneficial to where we've had nurses that have wanted to work in specific or targeted specific areas for working, for example, emergency care. We've got students that are sort of undertaking child health and adult health, but yeah, that in itself comes with its own sort of strengths and limitations.
Yeah, we see more now a push back, especially from an integrated care board perspective, that often learning disability and autism is wrapped up in mental health, when actually what we're seeing now is that kind of move back into that wider community perspective, but also the kind of the strong links back with children and young people, especially around the neurodevelopmental stuff, the pathways for assessment, all of that's which happens within childhood, more so than obviously than within mental health. And a lot of our LDA services sit within community providers rather than mental health providers. So it's getting a much bigger, I think, kind of recognition now, and I think it's being able to champion and those opportunities to champion the voice of all children and young people, whether they've got LD, mental health, physical health conditions. So however we can do it, we'll just add it all to the list. I think, Bernie, I think that's what we'll do.
Yeah.
Okay.
Just quickly, Simon, I've put the link into the project there. People are interested in perusing it. We do launch a newsletter, so if people are interested in receiving that newsletter, they can email me. I'll pop it into the chat as well, or if not, they are on the website. And like I said, we hold a sort of bi-yearly stakeholder group, which is open to any interested parties that want to come and hear about how the project's developing. So just to put that in there. But thank you.
Brilliant. Thank you, Matt. Thank you, everybody, for dialing in, and hope it's been a real learning curve for some of us who are not necessarily working directly within academia anymore, but actually just seeing the amount of work that is coming through, I think, our universities, as well as obviously with coming out from our newly qualified staff as well, in terms of and their experiences from going through that. And there's obviously that breadth of knowledge that that they can bring. I think I saw a comment from Bernie, and I think it was on LinkedIn the other day as well, about obviously the learning that you can get from newly qualified and student nurses, just as much as you can get from obviously experienced practitioners and as older folk, I guess. So yeah, it's all that cycle of learning, isn't it? So thank you, everybody. So just to let you know, the next webinar is taking place on the 13th of March, and that is with our own Norman Long from the Association of British Paediatric Nurses, and retired lecturer and principal lecturer and bank nurse. Norman was actually one of my professors when I was a student nurse, so at De Montfort University in Leicester. So it's been great reconnecting with Norman over the last few years in the ABPN. So and I think he was recently awarded a High Sheriff Award for his contribution to children's nursing and healthcare. So yeah, really looking forward to hearing Norman's webinar on supporting the family with a child who needs complex care. So thank you, everybody, for your time, and apologies for those for running over, but thank you for those who've stayed. It's been a really interesting conversation and webinar. So the links and the webinar will be shared onto the YouTube channel for the webinar, and the slides will be shared on the ABPN website. So please keep an eye out for those. And if you aren't a member of the ABPN, you can find details of how to register and become a member on the website as well, using our brand new platform.